welcome you back. This is In Focus, and it's time now for our health update.
And health reporter Linord Moudou joins us now with a look at a serious health crisis brewing in West Africa. Hi, Linord.
Hello, Vincent. Hello, Dimiake. That's right. More than 60,000 people living with HIV/AIDS in Ghana may be in danger after 2013 because the Global Fund, the main financier of treatment for HIV/AIDS locally, is set to withdraw its support due to inadequate funds. HIV patients in Ghana pay around $3 a month for antiretroviral drugs. The country's national health insurance does not cover the cost of the drugs, but people can receive treatment for health problems associated with AIDS. Faustina Okenche is the president of Networking Positive Women for Development, which helps women access antiretroviral treatment.
At times you don't have the money, but you have to take the drug too. It's not easy because of the stigma and the discrimination. Many of us are not working.
UNAIDS indicates that Ghana is among 5 countries in the sub-region where HIV declined by more than 25% among young people between 2001 and 2010. But Ghana is facing funding challenges, as the Global Fund to fight AIDS, tuberculosis, and malaria has decided to withdraw its support by 2013 due to inadequate funding. The Global Fund supports more than 70% of Ghana's anti-HIV campaigning. Many HIV/AIDS patients are now worried that treatment will even become harder to come by.
Sometimes when you are fortunate to have money and come to the hospital, they will tell you that the drugs are finished. So we are pleading because drugs are helping us. If there are no drugs, how can we get the strength?
Research data from 2011 shows that over 250,000 people are living with HIV/AIDS in Ghana, but only about 40,000 people are receiving antiretroviral therapy.
No problems also with your medication?
Dr. Na Ashley van der Puye works with the International Healthcare Center and AIDS Foundation in Ghana. She says she hopes that this will galvanize Ghanaians to find alternate funding.
Every day new ones are joining, new ones are being diagnosed. Eventually they would also have to go on treatment. So as we go along, you know, it's just increasing, and these medicines too are not cheap. So it's time that, you know, we sat down and looked for innovative ways to try and see how Ghanaians can take care of Ghanaians.
Ghana's government says it will focus on intensifying education programs with more emphasis on prevention. Dr. Joseph Yele Chire is Ghana's Minister of Health.
We will have to continue to update ourselves with the information as to whether we need to put more money inside. But because we have done very well as a nation in reducing the rate of infection, we think that the bill should be going down, hopefully go down.
And now joining us on the phone from Geneva, Switzerland, for more is Christoph Benn with the Global Fund to fight AIDS, tuberculosis, and malaria. Mr. Benn, welcome to In Focus.
Thank you very much indeed.
Now, can you explain to us some of the main aspects of this funding cut that was recently announced by the Global Fund?
Sure. So first, I think it's very important that I can reassure the people of Ghana, and particularly people living with HIV in Ghana, that the Global Fund is not withdrawing from Ghana, that we are going to continue to support Ghana and all people who are receiving AIDS treatment in Ghana. Actually, the Global Fund just celebrated its 10th anniversary, and Ghana was the first country that received a grant from the Global Fund in 2002. Since then, the Global Fund has supported 3.3 million people around the world with antiretroviral treatment, and millions of people are alive today because of this investment. So I can really assure the people of Ghana the Global Fund will be with you. However, what is the background to that story is that we are concerned that in the future, the money might not be as sufficient as it used to be in the years before. Therefore, we might not have the financial resources to scale up these programs, meaning to bring more people on treatment. As we heard in the introduction, there are, 250,000 people living with HIV in Ghana. They need treatment in the end. The Global Fund wants to support them, and therefore we are appealing to the donors to increase their funding also in the future years.
What about other countries that are being impacted? Of course, you're reassuring Ghana, but what about other countries? What is going to happen to these countries, and what is the reason actually why the funds are not coming in?
Right, the funds are coming in. The Global Fund in 2011 received all the money that was pledged to the Global Fund, and we have enough money to support all the ongoing programs in Ghana and many African countries and around the world. But what we've been saying to Ghana and other countries is we are not sure that we will have more resources in the future that will enable us to help these countries address all the people in need that are still requiring treatment in the future. That's our concern, not that the money is going down, but that the money is not going up enough so that we can bring all the people in need into the treatment programs.
So in 10 seconds, what are the strategies to address this issue?
We appeal to our donors that these are life-saving investments, and to all people around the world to support the Global Fund so that we can support people in Ghana and elsewhere to get the drugs that will keep them alive. Okay, thank you, Mr. Benn, for joining us today. And that was Christoph Benn. He is the Director for External Relations of the Global Fund to fight AIDS, tuberculosis, and malaria. He was joining us today from Geneva, Switzerland. We thank him.